Welcome to The Better Life with Dr. Mariane Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mariane Pinkston.
Hello there. Good morning. I am Dr. Mariane Pinkston, and I'm with you with The Better Life. But the better life I'm going to bring to you today is somebody that I admire greatly. So I'm so proud and so happy to have her on my show today. This is Dr. Pamela Smith, who is board certified in anti-aging and regenerative medicine, right? Is that the fault? Yes. And so you have to, it would take me all 27 minutes that I have for the program to introduce the accolades and things that this lady has done. And she is, you have 2 master's degrees. You spent 20 years in emergency medicine and then learn the integrative way of medicine that I think is wonderful, something I've done over the last 15 years. And you actually ushered me into integrative medicine, so I thank you for that. And also has been on many platforms for television, for radio, has written 11 books, and you have just accomplished so much. And you have written what I call the Hormone Bible, and everything I have learned from hormones, but I am so glad to have you in from Detroit. Where it's cold, I know, colder than San Antonio for sure, but welcome in. Thank you for being on.
Well, thank you so much for the opportunity.
Absolutely.
I appreciate it.
Absolutely. Well, so why you're here, out of those 11 books, I don't know if this is 12, but this is 11. This is 11. So out of your 11 books, you have written something that I think is just so apropos for the moment with COVID and everything. Everybody now finally, I mean, we've been talking about immune systems, you for 20 years and me for 15, immune systems, but now with COVID, I think everybody is interested in how to maximize their immune system, hence the name of the book, Max Your Immunity. So what drove you to write this and bring this forth to us?
Actually, my publisher did. I was not planning on writing this book. I was going to write, my next book was going to be autoimmune diseases. And as COVID hit, he said, no. Right. You're already looking at the idea of the immune system. Write a book. We'll call it Max Your Immunity. And I really am so excited about the book. It has 3 parts. The first part looks at the immune system. Part 2 looks at 10 things that everybody can do to build your immune system. And then part 3 looks at nutrients that help balance the immune system.
You know, all of your books are so informative. As a physician, you know, I read them and I get so much out of it. But this is also something that anybody can read and get a tremendous amount of information. And you cover so many different topics. Leaky gut, which is something that I talk about a lot on the show and affects your immunity about, you know, there's just so many different things that it incorporates all together. What is something that you think somebody who sits and reads it should pull from this? I mean, you've got like all the vitamins and things that we should have, but what is something that the point that somebody should really pull from this for themselves?
Well, it's written in a bullet style format, as you pointed out, and that is a credit to my publisher, Square One Publishing. Everything that they do is bullet style format, so it's a reference guide.
Absolutely.
So we do have 2 kinds of immune systems. One is the innate and one is the adaptive. The innate immune system is what you're born with and what happens when you first get an infection or neurotoxin. And then the adaptive is how your body adapts. You know, what happens later on. You're not born with that. Right. And that's the one that produces antibodies and other things so that hopefully you're immune for the rest of your life.
Exactly. And so is that the one that also goes off and causes us to be autoimmune or our immune system to attack us?
It does. There's a lot of reasons for autoimmune diseases themselves. And we're starting now to realize that for some people that get COVID long haul syndrome, it is an autoimmune process where the body does attack itself and it kind of goes haywire and you have to settle that autoimmunity down.
Right. So good. So how does somebody go about doing that?
Well, first of all, when it comes to the immune system, we take everybody off of gluten if they have an autoimmune disease. Everybody in the world does not need to avoid gluten, but if you have an autoimmune process, it is a great thing to do. Number 2, we fix the gut. When you look at the immune system, 70% of the immune system is in the gut, the GI tract. And it's interesting. This is my 44th year of practice. I've never had a patient with an autoimmune disease or a major infection they couldn't get rid of that had a healthy gut.
Exactly.
And people always think, oh, well, I don't have reflux, I don't have GERD, I don't have any of these things, I don't have a gut problem. When we do a gut health test, they're surprised.
Exactly.
And it's inflamed. There's all these other things that happen. So a healthy gut equals a healthy person.
Right.
Autoimmune disease or not. And then if you have an autoimmune disease, for people who've had cancer, people who want to lose weight, people who have COVID long haul, people who have diabetes, they're inflammatory diseases. And there's a compounded prescription that I write for them all the time, which you're very familiar with, called Lowdose Naltrexone.
Absolutely.
And Lowdose Naltrexone is awesome.
Yes.
It is an actual prescription in the regular dose that we use for drug overdoses. As a low dose, it is compounded, and it gets rid of inflammation.
Right.
And that's the key.
Right.
In fact, almost every disease process you can think of after the age of 45 is inflammatory, including memory loss. So I love low-dose naltrexone.
Right, right. Low-dose naltrexone. And so when I talk to patients about using it, I explain the depth and versatility of it. And they're like, how does it treat so many different, why is it effective against so many different things? Because if you have GERD, you take an antacid. If you have, high cholesterol, you take a statin, which we don't really use with patients very often. But that thought is it just takes one medicine for one disease. How come this one does so much for so many?
Well, it's looking at the cause of the problem. And that is what I love about a precision medicine approach.
Right.
It is looking at the cause. And usually it's multifactorial. Many things are related to why people have a compromised immune system.
Absolutely.
And they can't lose weight and many other things.
Right.
So I love looking at the cause.
Right, absolutely. And I think that's what's so wonderful about integrative medicine is going back to the cause rather than just a prescription to, take care of symptoms, which causes another symptom, which needs another medication, and on and so forth. Well, so with COVID, I know so many people are focused on COVID now, whether they do the vaccine, whether they don't, most patients when they get it, everybody's so different in how it affects them. What is your thoughts on why it's so different for everybody?
Well, everybody has a different immune system. So let's take men versus women.
Right.
A lot of people don't realize that women have a different immune system than men do because women are designed to have children if they choose to have them. And if a woman didn't have a different immune system, she would miscarry every time she got pregnant. The immune system is different so that you can carry the baby to term because literally the baby is part you and part your partner.
Right.
And so it's not all you. And so the body sees it as a foreign body if you had the same immune system as a male.
Right.
So women with a different immune system also have an increase in some diseases like rheumatoid arthritis and lupus that men don't.
Right.
And it's all about balance. That's
Right.
what I love to tell patients.
Absolutely.
We want to go back and balance the body.
Exactly. So it is. You do focus on that, whether it's hormones, whether it's the immune system. It is. It's all about finding the cause and finding the balance. You mentioned something last night. I saw a great lecture from you last night. And so when you spoke about sugar. So you said underlying every, disease, every cancer, every, difficulty, for every difficulty losing weight or whatever disease that, you've seen autoimmune wise, there's sugar underneath that. And so I think is that something that you try to highlight with most of your patients and in your book and things like that is to try to pull people away from sugar? Because I have a hard time getting people to give that up.
I have a hard time with that personally, and I don't mind admitting that.
Exactly.
I truly don't. Sugar is hard. They actually did a study on laboratory animals, and they put out 2 bowls. Bowl number 1 had cocaine. Bowl number 2 had sugar. 100% of the little laboratory animals ran to the sugar and not the cocaine. So that tells you how addicting that sugar is.
I don't know if anybody could tell from my face on YouTube. I've got the radio that we do and we've got podcasts, but on YouTube, my face, my jaw is like hitting the ground right now. I had no idea.
It's that addicting. And from Nancy Appleton's work, Dr. Appleton was a PhD, and she spent her entire life looking at sugar. And she wrote Death by so many books. When you look at sugar, there's 87 diseases that are related to what happens with sugar because it sets up an inflammatory response in the body.
Absolutely. So, I've studied data about, how the brain reacts with dopamine and the reward centers with sugar is similar to cocaine or heroin. Anything with an addictive quality, will light up on the MRI, and sugar does the same thing addictive-wise. I didn't know rats would choose sugar over cocaine, but that says a lot about, a rat brain versus a human brain in some cases, right? Well, so, going back to the gut a little bit, because this is something that I probably have the hardest time explaining to patients about, why the gut is so important. It's an intestine. What it does is it just eliminates. And so, I explain to people it has so much to do with your brain chemistry, with your hormone production, with, your weight, with your immune system especially. So how do you talk to your patients about the importance of gut health, get them to understand fully?
Well, it depends really on what the patient comes in with. If they have an autoimmune disease, we already know the gut's not healthy. But almost every patient in my entire practice, eventually we look at the gut. Mm-hmm. And when we look at that idea, it's about, is it infection, perhaps? Mm-hmm. Is it dysbiosis, meaning too much bad bacteria and not enough good bacteria, perhaps, which would lead to leaky gut. The lining of the gut is semi-permeable, which means good things stay in, bad things should stay out. Sure. And when you have dysbiosis for a long time, that leads to leaky gut syndrome, and that permeable membrane becomes really permeable, and bad things come into the body that should not. Exactly. All of that is fixable. Mm-hmm. Whether you have an infection, whether you set up an inflammatory response, any of those things, there's not a single patient that we cannot help have a healthy gut.
That is amazing, right?
It really is.
Is it, and, could it really be that simple? It's amazing to me that it all comes down, and you talk about looking at the cause, that it all comes down to something that really is so simple, but at the same time it's so difficult to, get across to people about how important it is, but what to do about it. And so again, I know it depends on a lot of the diseases that people have, but what is your basic formula for telling patients to heal their gut?
Well, a lot of people don't understand what a healthy digestive system is. Mm-hmm. They come into us and they say, oh, I have one bowel movement a week. Do you think that's a problem? A healthy patient's digestive system is 2 bowel movements a day. Mm-hmm. A day. Mm-hmm. It's not healthy to have reflux, constipation, diarrhea. No. Some people have symptoms that are related to their gut that occur outside their gut. Yeah, absolutely. And so they may have brain fog. Mm-hmm. They may have muscle aches and pains, all of those other things. And in looking at that, they're surprised. Mm-hmm. Oh my gosh, you fixed my gut and my brain fog is gone. Right. I don't feel like I can't have word retrieval issues and all those other things. How did you know that? Again, it's about looking at the cause of the problem. Absolutely. And there's so many great tests that are out from an anti-aging viewpoint that are functional medicine labs, where they're different than labs that are done at a traditional laboratory, and we can look at a gut health test and really fix the problem.
Absolutely, which is phenomenal, and I love. Another thing that I learned from you some time ago, I won't say a long time ago, and then expose myself or you here about how long we've been doing this, but and I know we want, it's so wonderful to have somebody like you on with the wealth of knowledge. I mean, borrow your brain for a day. It would take me a week to get even this much, I think, of what you know. And I know we want to focus a lot on the book. So in the next, we're going to take a break here in just a second. The next half, I want to focus a little bit further on it, because I really think this is something people ought to very simply invest in. I say invest, it's not an investment in money, but definitely investment in time for you to learn about your immunity. I'm going to say a word, though, about Pinnacle Clinical Research, who is very kindly been a sponsor for me over the last month or so. Dr. Harrison and his group at Pinnacle has been absolutely a mainstay for my patients. I have a lot of patients who, with inflammation, have the fatty liver syndrome. So 1 in 3 adults have fatty liver and don't really realize that they have it. So with clinical research and Pinnacle Clinical Research and Dr. Harrison, they are able to check patients, and they have a free scan, a FibroScan that they can do for you. And this, if there's something that they find, they can go with insurance and or they have some great deals with private pay, but you can get a free FibroScan. So I'm gonna give you a couple of numbers, and this will be on my website for clinicalresearch.com, pinnacleresearch.com, excuse me. And in Austin, it's 512-601-5788. I do have a lot of listeners in Austin. So San Antonio, 210-529-7978. And again, that will be on my website. And my website is drpbetterlife.com. And you can find all the links to YouTube and iTunes, Spotify, all of the platforms for podcasts. And so I would love for you guys to look Pinnacle up, and we can refer you in. So again, we'll take a short break and come back on the other side for a short 7 minutes to finish up. I could keep you for a year over here, and we'll talk more about the book. Is there a place, I know, Amazon, everybody goes to Amazon. Is there a place where they could find your book and support you a little bit more, or is Amazon where to go?
You can find my book at any major bookstore, of course, on Amazon and most compounding pharmacies as well.
Absolutely. So that's great. And I will have all this information as well on my site so that you can find Dr. Smith. I will have her website and all the information that you can find. She's got so many books, so many wonderful things that I give to patients to learn every day. So I'll give my website one more time. It's drpbetterlife.com. And you can find all the platforms there. And you can also find information about where to find me in San Antonio. I do see patients, and I take insurance and private pay as well, and do a lot of these functional labs that she is mentioning. And so when we come back on the other side, we'll talk a little bit more about Max Your Immunity with Dr. Smith. Thank you.
Fatty liver is linked to two different situations, alcohol and diabetes, or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and/or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back. I am with Dr. Pamela Smith today, who has filled our heads full of interesting information about how to max your immunity, which is the name of her book. It's her 11th book that is out now, and very well written, very easy to follow. It has so much information. I can't believe you got it into such a thin book with so much information. And so we talked about, different types of the immune system, leaky gut, all these factors, but there's something that I think we've left out. And that is stress, and how stress, and I talk a lot about stress, I think because I live so much stress. We all do. I mean, nobody's immune to it. But stress and your immunity, how do you focus on that with the book and with your patients?
Well, a little bit of stress is good. Stress actually can help you think better, etc. Sure. If it's short term. But long-term stress compromises the immune system, drives up cholesterol, blood sugar, blood pressure, puts weight on you.
Right.
The thyroid that regulates your whole body doesn't work very well if you're stressed. And that's why I always encourage people to come in and see fabulous practitioners like you.
Thank you.
And the reason I do that is because you have to measure.
Yes.
The way to measure looking at cortisol, the stress hormone, is to do a saliva test. That is the gold standard. Yes. There's 6 medical trials showing that. And we like to do what's called a 4-point. And that's what you do in your practice. 8 in the morning, 12 noon, 4 p.m., 10 to 11 p.m. And that way we can really help the patient, because otherwise they do start gaining weight. And they're surprised that when people are all stressed right now, oh my gosh, all of a sudden I have high blood pressure. My blood sugar used to be normal. It's not.
Yes.
And so stress reduction techniques, prayer, meditation, Tai Chi, yoga, Qigong, exercise, massage, breathing techniques, acupuncture are the place to start.
Absolutely.
Number 2 is a multivitamin. And then they really do need to know where their cortisol is.
Yes.
That's why it needs to be measured, because if you stay stressed a long time, then cortisol becomes too low. And it's important to look at, because when you're first stressed, cortisol elevates. When it becomes too low, you have to have cortisol to live. If you don't have cortisol, you die in 7 days. So what the body will do is take the hormone, and I know you've discussed this on your show, called pregnenolone. Hard to say and hard to spell. It's Pregnenolone. Pregnenolone is your hormone of memory. So at any age, if you stay stressed, the body will take pregnenolone to make cortisol to keep you alive.
Right.
So you can have brain fog and word retrieval issues, even if you're 25, if you stay stressed.
Yes, absolutely. And I see that all the time. I think the adolescents and the 20-year-olds of this day are so much more stressed than what I was, or even maybe you were, back when we were younger. And I see a lot of problems. I see a lot of people come in wanting to be treated for ADD. I tell them, so I don't really think that's what's going on, and look at things like that. I think pregnenolone has a lot to do with that as the basis and of all of their hormones, because it's the basis of how you make all your hormones. So it involves so many different things. With saliva testing, I know that patients ask me a lot of times about the cost. I think there was somebody last night at the lecture asked about cost, and I try to convey to people that you spend time and money on your cell phone and going out and eating with your family or things like that. And you mentioned last night, I loved it when you said that it's about the same as a good dinner out with your spouse. And these tests that you mentioned are not super expensive, and you don't have to redo them over and over like you do other tests at the doctor. But as you get to know your system, your body, and do these tests, it really does give you a lot more information about the cost of what's going on with your body. And so I think it's more. You mentioned a couple things. We've only got 2 minutes left. It amazes me how time flies. Are there any other vitamins or supplements or so that you feel like are helpful for people from, just kind of a baseline? We've got COVID out there. We've got all these things going on. What do you recommend?
Well, certainly vitamin D would be the first choice, because vitamin D is actually a hormone or prohormone. It's not really a vitamin, and vitamin D is so important for the immune system. It's important for breast health, so it helps prevent breast cancer. For men, it helps prevent prostate cancer. It is one of the best immune builders that you could ever have. Exactly,
and I think we harp on vitamin D all the time, but I don't think the media and all harp on it quite enough. I don't think they harp on a lot of things quite enough as far as, what we can do as a basis. And so, these are all things we can test. These are all things we can treat. And we haven't even talked about a prescription yet. Except LDN, which in my mind is kind of like, isn't really a prescription, but it's a lifesaver for sure. But all these things are things that are available to you that you can come and see me at the clinic here in San Antonio, and I will have a lot of this information on my website. I'm also going to put Dr. Smith's information on the website. I'll even put a link to her book too, and please look into all of her books. She's got some fantastic information. Hormones, the way I practice with my hormone therapy is based on everything that I've learned from Dr. Smith, and that is no lie. So I'll have all this information at drpbetterlife.com, and you can find all the links, YouTube, and all the platforms for podcasts. And then, of course, I'm on radio here in San Antonio, and it has absolutely been such a pleasure and honor to have you with me today. Thank you for all that you do, especially given that you do so much speaking at A4M, the American Academy of Anti-Aging and all. You have the fellowship, which I have been a part of, and hopefully we'll finish one of these days. It's insanity. But you have changed so many lives and so important to the field. Just thank you so much for everything that you do.
Oh, truly my pleasure. It is so important to help people not just be healthy, but stay healthy.
Absolutely.
Everybody can live to be a healthy 100 years of age if you look at the cause of the problem.
Right. which you do, we do, you've taught me to do, and I love. And so thank you guys very much. DRP, betterlife.com for all information. And thank you again. Have a great day.